Hey guys, welcome back. Dr. Shred here. Today we're going to talk about high blood pressure, otherwise known as hypertension. We're talking about what it does to your body and some common sense things that you can do to control your blood pressure. Let's get into it. So let's talk about high blood pressure. High blood pressure occurs when the blood pressure in your arteries gets too high. And we define that as being above the systolic blood pressure, the top number being above 140, and the lower number, the diastolic blood pressure, being above 90. High blood pressure is super common. It affects about 15 to 40% of people worldwide. And it's known as a silent killer because high blood pressure, until it gets to be extreme, causes no symptoms. So you won't know you have high blood pressure unless you monitor and check your blood pressure periodically. So I encourage you to go and get your yearly physical, and if you can, buy a blood pressure cuff from the drugstore and check your blood pressure once a month and just see how it is and make sure it runs well. And when it comes to the numbers, the systolic and diastolic, they're both equally important. So if your blood pressure is only high on the top, that's important. If it's only high on the bottom, that's important. You want to get both numbers controlled. So what are the different types of high blood pressure? There's really two categories, primary and secondary. Primary, which is otherwise called essential, is what about 95% of blood pressure is. So it's the most common thing, and we're going to focus on that topic. Primary has some genetic basis, so if your mom and dad had high blood pressure, you're more likely to get it. Another reason you should monitor your blood pressure. But it also has some lifestyle issues. If you're overweight, that contributes. If you're not exercising and you're sedentary, that contributes. And if you eat excess salt, that can also increase your risk of getting high blood pressure. Secondary causes, which again account for 5% or less of causes of high blood pressure, are very rare. In my practice of 25 years, I've probably seen a handful of secondary cases. They would include conditions like pheochromocytoma, Cushing disease, and renal artery stenosis, and again, they're very uncommon, so we're not going to talk about them too much. Okay, so what does high blood pressure do to your body? High blood pressure, as I mentioned, is high pressure in the arteries, and somehow it damages the arteries, and that leads to increased risk of cholesterol buildup in the arteries of your body. If it affects your heart, that can increase the risk of chest pain when you exercise, or even a heart attack or sudden death. If it affects the arteries in your brain and your neck going up to your brain, it can increase the risk of stroke. It can affect your kidneys by damaging the kidney arteries and the arterioles in your kidney. That can cause kidney failure and lead to renal failure. It can also affect your eye, causing vision loss. And some people believe high blood pressure increases the risk of dementia as well. So uncontrolled high blood pressure has lots of negative consequences that you definitely want to avoid. The good news is if you keep your blood pressure tightly controlled, meaning controlling it around 120/80 or so, you can avoid all of those long-term consequences that I mentioned. So it's important to see if you have high blood pressure and then control it well. How do we treat high blood pressure? We typically treat high blood pressure with lifestyle modifications and medications. There's different classes of medications that we use. Most patients can be controlled with 1 to 3 types of different medications. I have some patients that have such severe hypertension it's refractory and they need 7 or 8 different classes of medications to control their blood pressure, but that's relatively uncommon. To say your blood pressure is controlled, we want to have it running below 140/90, according to most physicians' thoughts. There's some new studies that have come out that showed if we get it even lower, below 130/80, people do better. But sometimes that causes some consequences like dizziness or lightheadedness. If you're out in the heat today and sweating like I am, that can cause you to get a little lightheaded. So talk to your doctor about your blood pressure treatment goals. Let's talk about lifestyle changes. Those are the most important things you can do for your blood pressure in addition to taking medications. So first is exercise. It's important to get some aerobic activity. Walking, for example, is good. Riding a bike, walking on a treadmill are all important to help control your blood pressure. When you exercise, you release endorphins. They help dilate the arteries of your body and reduce the resistance of blood flowing through your tissue, and that's what leads to a drop in your blood pressure. Exercise, weight loss is critically important. When you lose weight, your blood pressure comes down. It may be the fat that's stored, the extra blood vessels that are circulating through your fat increases the resistance of blood to move through your body, and that causes the blood pressure to go up. So weight reduction is critically important. And finally, salt reduction is also important. Salt enters your blood system and stays there for the most part. So if you eat a lot of salt, you're filling your blood vessels up with more fluid, and that can increase the blood pressure. So a low salt diet is also important. In addition, if you smoke, stopping smoking helps control your blood pressure. If you drink a lot of alcohol, reducing alcohol intake helps control your blood pressure. And if you have a lot of stress, trying to reduce stress through changing the environment or even taking medications that relieve anxiety and stress can help control your blood pressure as well. So specific lifestyle changes as far as being overweight. I want you to lose your weight. Look at my Lose Your Rind series. It may help you achieve significant weight loss, but you need to get your weight down to a lean body mass like I had. If you can get as lean as you can, that'll improve the chance of getting your blood pressure to go away or to control it well. Exercise is also critically important, and if you look at my workout series, that may help you as well. Exercise, we're talking about at least 3 or 4 times a week, at least 30 to 40 minutes at a time, and the more you do, the better. So if you get into riding a bike or running, that's better for your blood pressure than just a short walk. So I want you to start exercising, work out at least 4 or 5 times a week, and that'll help control your blood pressure as well. And then as far as salt intake, a big question I get is, how much salt should I eat? So we recommend about 1,500 to 2,000 milligrams of salt per day if you have high blood pressure. That's pretty low, because salt is in things that you eat naturally. So you have to look at everything that you eat, not just table salt you're adding. But try to look at what you eat and try to minimize it to that amount, and that can help control your blood pressure. So there's high blood pressure or hypertension in a nutshell. I explained what hypertension is, what it causes to your body, and things you can do to control it in addition to taking medications your doctor may prescribe. If you have a chance, look at my other videos. I have an extensive series on weight loss that can help you control your weight, and a lot of exercise videos that can help you move and exercise more to help control your blood pressure so you live healthier and longer and live a more satisfied life. Thanks for watching.